I want to thank you, Pat, for all of your wonderful, collaborative, caring, and thoughtful leadership of the department and in the school over the last decade. In particular, you've been a valued and trusted partner with me as we developed the Child Health Institute of New Jersey and grew the Child Health Institute building as the hub of outstanding clinical care, wonderful research, and great education in pediatrics for the department, the school, and the whole community.
And we really are all working together for the purpose of making every child healthier.
Pat, you've been a strong, forceful, and persistent voice as an advocate of children and of the department during these very, very challenging times. Times which included those who would have sought to diminish the department or marginalize it in some way. And yet you have persisted and continued to make the department and the school a better place.
Hi, Dr. Whitley-Williams. I just wanted to thank you for all of your leadership and guidance over the past few years. It has been a pleasure working with you, and I wish you continued success in all of your endeavors. Thank you.
Hi, Dr. Whitley. Congratulations on your term as chair, Department of Pediatrics. You should be real proud of all your successes over the years. I just want to personally thank you for the last 4 years working for you as department administrator. You made it a job that I wanted to come in and work for you and help you do what was necessary for the department to succeed. You just showed so much respect for everybody and was always there with a smile when anyone needed them. So you should really feel proud for everything that you've done, and I want to thank you once again.
I'm glad I have this opportunity to say thank you to Dr. Patricia Whitley-Williams. I've served as Vice Chair of Pediatrics, and so over these past 5 or 6 years, I've had a lot of up-close time with Dr. Whitley-Williams, and her public face was always, whether she's on the wards or leading meetings, the division chief meeting, is always positive, and we've got to do this, and we've got to move forward. And we still have a lot of strengths in our department. The fact that we have what we have is in no small way, in fact, in a very large part, due to the steady leadership we've had from Dr. Whitley-Williams. She has been a rock. She's been had a positive attitude and a positive force. So thank you, Pat. I'm really sorry that I can't be there, but if I were, I'd give you a hug and say thank you for all you've done.
Dr. Pat, I am a big fan of giving people their accolades while they're still around to receive them. So I just want to take this opportunity to say thank you. It's been a great 3 years working with you. I look forward to all the times that we'll have to work together still. And you are an amazing, amazing woman. From your clinical knowledge, I've seen you interact with patients, faculty, staff, you are amazing. And I look forward to the next chapter and continuing on this ride with you. And I just wish you all the best as you shift from being the chair to just being you. And it's very, very easy for you. And thanks. I appreciate you.
Hi, Dr. Whitley-Williams. I just wanted to thank you from the bottom of my heart for being an inspiration, a role model, a mentor, a phenomenal teacher, not only to myself, but also to the entire faculty here at Robert Wood Johnson in the Department of Pediatrics, to all the residents, to the ancillary staff, and also to my 3 daughters. You have inspired me over the last 12 years since I've been at this institution to be a better clinician, a better teacher, a better mentor.
And I also recognize the infants, especially the high-risk infants, the preemies, as those children who need advocacy and who certainly are the unspoken voices. And that's why I went into pediatrics, and I hope I motivated you.
You exhibit a tremendous amount of passion towards patient care and their well-being, which of course is so contagious. And I thank you. Words are not enough to thank you for all that you've done.
Hi, Dr. Whitley. This is your favorite program director. And yes, Dr. Kelly, I am her favorite. I met Dr. Whitley first in 2000 when I started here as a pediatric resident. So that's 17 years ago. And over the years, I've come to really appreciate you as a mentor and an example that I hope one day to live up to, especially your calm demeanor. I really need to acquire that. And just your way of handling patients and their families, what a great teacher you are, how fabulous a manner of support you've been to the pediatric residency program, the residents and myself in general. So thank you for all of that. I am very happy that you're still going to be just one office away, and I will be in there as frequently as before to complain and obtain counseling. Thank you very much.
Hi, Dr. Whitley-Williams. I wanted to say thank you for being there and creating a family atmosphere here in pediatrics. And we enjoyed your tenure as chairman of pediatrics, and good luck with everything in the future.
Thank you, Dr. Whitley-Williams.
Thank you very much, Dr. Whitley-Williams.
Thank you, Dr. Whitley-Williams.
Ready? Woo! Woo!
Hi, Dr. Whitley-Williams. We all came together to thank you for all your hard work and dedication and long hours that you spent for the Department of Pediatric Specialties. So we're all here to say, thank you!
Nut 1,
Nut 2,
Nut 3. Dr. Whitley-Williams, we just wanted you to know how much we appreciate your dedication and hard work.
Thanks for your never-ending support. Eat fruit and prosper.
So Pat, the good news about today and this transition is that you'll still be here. And knowing you every day, you'll still bring to the medical school your wonderful energy, enthusiasm, and commitment to making this a better place. We all thank you for that, and I look forward to working with you for years to come.
I love pediatrics. I'm always going to be a pediatrician. I would never do anything else. So I hope at the end of this talk, I hope I will have inspired many of you to look at pediatrics, but just also to think about the importance of children.
Through thick or thin, near or far, Pat is always our star. 1, 2, 3. Happy New Year!